Hello and welcome back to GP Video Podcast by Nadia. So as you guys know that today I have started the topic of polycystic ovarian syndrome, but not to make things too boring. I have just decided that at one time I will be actually carrying forward 3 to 4 different topics so that whoever is interested in whatever topic, he can pick that topic that day. And as you know that I'm making 2 video podcasts a day, so I'm sure that I can carry forward a few topics all together. So so the topic today that I have decided to go ahead with is called bowel cancer or colon cancer. It is actually one of the most diagnosed cancers in Australia at this stage. So it is very, very important to be talking about this cancer at this stage. So bowel cancer is also known as colorectal cancer, and it develops from the inner lining of the bowel and is usually preceded by growths called polyps, which may become invasive cancer if undetected. So what is bowel or what is colon? What happens is for this we need to really know what is our digestive tract. I'll simply try and tell you how the digestive tract really works. So when we eat the food, it goes into our mouth. Surprise, surprise. So after mouth, it then goes to an area called pharynx, which is in the throat. Pharynx, which is at the back of the larynx, which is the windpipe, pharynx. After pharynx, the area which comes in the chest is called esophagus. Esophagus leads to stomach. Stomach then leads to small intestine. Small intestine leads to large intestine. Large intestine is also called as colon. And then colon leads to rectum, and from the rectum, then anus, and then the food comes out. So food goes in and then comes out. So small intestine and large intestine. Large intestine is called colon, and that is called bowel cancer, and that is called colorectal cancer, because sometimes colon and this end part, like which connects to the rectum, that also can get a shared tumor, so that is called colorectal cancer. Okay, so now we know what is colon. It is called the large bowel or large intestine or large bowel cancer or large intestine cancer or colon cancer or colorectal cancer. Okay, so it develops from the inner lining of the bowel. Again, all the organs almost have 3 kinds of linings. One is the outer lining of there, then is the muscular lining, then is the inner lining. So the cancer that we are talking about actually arises from the inner lining of the colon or inner lining of the large intestine, usually preceded by growths called polyps, which may become invasive if go undetected. And how are these polyps diagnosed? These polyps are usually diagnosed like on the investigations by a CT scan, or most assuredly, most probably with the colonoscopy, because what happens is in colonoscopy, these polyps can be removed, the biopsies can be taken, and these polyps can be sent off for, not the biopsy, the entire polyp can be sent off for testing, and then the testing would show us what kind of polyps they are and whether they have the potential to become malignant or cancerous or not. Okay, so I've made things very simple for us to understand what is colon cancer, and I again repeat all of that so we all know. So mouth, pharynx, esophagus, stomach, small intestine, large intestine, rectum, anus, out. So, and what is colon cancer? Colon cancer is the cancer of the large intestine, or it is also called as bowel cancer. And so large intestine cancer is called colon cancer. And where does the colon cancer arise from? It arises from the inner lining of the bowel and is usually preceded by growths called polyps, which may become invasive cancer if undetected. So if these polyps are removed on time, then they do not become invasive. Depending on where the cancer begins, bowel cancer may be called colon or rectal cancer. As I said, if it doesn't involve the rectum, which is the last part of the alimentary tract, then it is only called colon. But if it is both in colon and at the part where it's joining the rectum as well, it's called colorectal cancer. It is estimated that 15,502 people will be unfortunately diagnosed. Okay, now I'm telling you the statistics of 2024. So 2024 is ending. So it means that yes, 15,542 people must have been, around this number, must have been diagnosed with bowel cancer in 2024. And I'm one of the witnesses, because unfortunately, few of my patients, you remember that I spoke about them the other day when I said that one 47 years old and one 60 years old, that was about prostate cancer though. Sorry, I'm mixing the numbers here. So that was prostate cancer. But then I've had actually the youngest male that was my patient who got diagnosed with colon cancer is 36 years old. And the oldest that I have seen was in his late 60s. So around, if you say that around 16,000 people in Australia were diagnosed with bowel cancer this year, that is a huge number. And the average age at diagnosis is 69 years old. So the average age at diagnosis is 69 years old. And bowel cancer or colon cancer is the fourth most commonly diagnosed cancer in Australia. So the fourth most commonly diagnosed cancer in Australia. And it is estimated that 1 in 20 people will be diagnosed by the time they are 85. So the average age at diagnosis is 69 years old. But 1 in 20 people will be diagnosed by the time they are 85, and it is the fourth most commonly diagnosed cancer in Australia. So what is the screening program for it? So I think I've already spoken about it, but I will talk to you again about it. Australia has a national screening program for colon cancer, which is very, very good. People aged 50 to 74, all the people aged 50 to 74, all men and women, are sent a bowel screening kit or test every 2 years as part of the National Bowel Cancer Screening Program. I would repeat it again. People aged, everybody aged 50 to 75, whether risk or no risk, whether men or women, are sent a bowel screening test, which is also known as fecal occult blood test screening kit, to their houses every